Hello, everybody. Oh, hold on. I gotta wipe my nose out. Today is February the 4th. I just want to check in with y'all, let y'all know your girl's still living. As y'all know, I told y'all I had that surgery, that emergency gallbladder surgery on the 26th of January. Ooh, my lips was dry. And y'all, when I say I had skipped dialysis that Saturday, of course. I didn't stay in the hospital. Oh, I did give y'all an update, but I wasn't in the picture, in the video. But anyway, on Monday, since I missed Saturday, the 22nd, my regular scheduled day for dialysis, they want me to come in that Monday. Well, y'all, I came in, I could barely hold my head up. Of course, my son, he drove me there. I had not eaten. I did not have no appetite, and I was still spitting up. So, of course, they couldn't dialyze me, and I was dry heaving where wasn't nothing on my stomach, and you can hear me all over the room. It was embarrassing, but I didn't care because sister didn't feel good. But anyway, so they did stick me with one needle to check my potassium level, because if my potassium level was too high, then they probably would have tried to dialyze me a little bit. But my potassium was good, so the clinic nurse came over, and she pulled on my skin and stuff, and she was like, "Mamie, I'm going to have to call the surgeon and see what we need to do, because you done lost too much weight, and something about the elasticity, whatever, something in my skin, they can pinch your skin up, and that's one of the signs of dehydration." And so anyway, she called my surgeon, and he said, just send her by ambulance. Oh my gosh, y'all. All I could worry about was that I'm a $600 bill. And I was like, oh, well, I need to go. But I really didn't want to, because I knew I was going to be sitting in that lobby. Well, y'all, let's say I went on by ambulance. I sat in the part with the ambulance people and other patients, and on the other side of the ER that I didn't know existed. I sat there for an hour and a half. Then they put me in a wheelchair, y'all, and I finally got triage. And then they set me in the ER lobby with everybody else, and all I could think about was, Lord, if I still don't have COVID, I'm gonna be COVID positive now. It was so many people, and it was like everybody was like sick with a stomach bug or something, because everybody had a little basin, like that little gray thing they used to give you back in the day at the hospital to throw up in. It's like everybody had one. And so, y'all, when I say I sat there to almost, well, no, it was after 9 o'clock, and I had arrived at the hospital on the 1 o'clock hour. And so, anyway, by the time they got a room open, that's all I was waiting on. Now, the triage nurse had gave me an IV, and she said, well, she asked me about my pain level and all that, and I told her, she was like, well, you want a little morphine? And I was like, oh, no, honey, And so she put me in the lobby. She said she was going to order me some IV bags so I can get some fluid in me. Y'all, when I say I didn't get those fluid bags until my room became available about 9 o'clock or after, or something like that. And this was a emergency room, bedroom. And so I went in there, and they said all of my labs look good, all except for my bun. Now, my bun is one of the labs that they take at dialysis. And that, it just shows what's all in your blood. And they did say that was bad. And then another doctor came in there. He said, The woman doctor came in there and she said, well, I'm gonna give you just a tad bit of morphine just to take your pain down. And I said, okay, but I said, but don't give me a lot because I don't want to be sick. She said, no, I'm going to put it through your IV. And she got the morphine. She gave me a little bit. And honey, when she pushed that morphine in my line, y'all, when I say, honey, I was on cloud 100. I don't know, but I was feeling so good. And honey, at first, I was mad at my clinic nurse for sending me in the ambulance, creating that $600 bill, riding in that ambulance, sending me to that hospital with all them germs. But girl, honey, once that morphine got in my IV, honey, I wasn't mad at her no more, honey. But anyway, so after the morphine got in there and she said, now I'm getting ready to give you a little fluid. She said, because you're severely dehydrated. And one thing about this little scenario that I learned on Monday, that they didn't give me no fluids when I was being prepped for surgery and after surgery, because they don't, if you're a dialysis patient, they don't want to overload you with too much fluid. Because sometimes a little bit fluid for dialysis patients can be too much, And so with me not eating all them days, and when I did try to take in fluid by mouth, I was throwing it back up. And then going through that surgery and just going through all that. And I had all of those meds, the cocktail they give you to put you to sleep. I had all that in my system. And so they explained, that's how I got severely dehydrated. But not only that, they said that I really needed to have a treatment. Even though technically I only missed one day, which was Saturday, and I was supposed to go Monday to make it up, but they sent me to the hospital. All those meds they gave me to put me to sleep and doing surgery and all that stuff had built in my blood, and it wasn't going to go anywhere until I went and got my full dialysis treatment. And so, I was like, dang, well, that does make sense, And so I stayed at the hospital till maybe about going on 2 in the morning, Tuesday morning. And I ate a few chips. I drank 1 whole Sprite, ate 2 cups of ice chips, and then that was it. And so I went home and I went to sleep. I went to my dialysis treatment, where I'm still underweight. It took a toll on me. I felt like I just been jumped. And they eventually had to turn the machine off and just clean the blood. It's the way they can put the machine in what they call minimum. And the artificial kidney machine, it does 2 things. It cleans your blood, and then it pulls off any fluid you gain in between treatments. And since I didn't gain any fluid and I was well under my weight, they actually had to give me 100 cc's of fluid on top of the 0.3 I was going to get back when they rinsed my blood back in me at the end of my treatment. So let's just say this Tuesday and this Thursday, the treatments are being really, rough on me a little bit. And I still, I haven't picked up my weight and my weight back. But once I start eating more and taking in the fluids, the fluid amounts that I can take in, my weight will go up. But I'm going to try my best to make it not go back up. I lost a total of 15 pounds in like a week and a half. So, now I'm just trying to recover from this, from this procedure. And it's been rough, and my appetite is not good. I'm still, barely eating. I'm eating enough, to take my medicines, I'm just, I don't feel good. And I don't feel like myself mentally either, but that's what surgery does to you. But I haven't had a major surgery like that since my son was born, and he's 26 years old. Now I've had a left knee ACL repair with 2 screws, and they put me under, and then I had to be put to sleep when I had the surgery on my arm to get my fistula, for the dialysis. But other than that, I haven't had any major surgery up until now, and it kind of took a toll on me. I'm not gonna lie, and but I've been getting some rest, and I am getting my strength back. I have not walked. I have not been in the gym, and it's probably gonna be a while before I get back in the gym. But what I'm going to do is try to do some stuff I can sit down and do, like arm lifts, and I was going to say sit in a chair, sit at the end of the chair and lean back and probably do some sit-ups. But I'm going to wait 2 more weeks for that, because I went to my post-surgery follow-up today, and they was looking at my little surgical scars, and they look good. But I still have some pain, so a little bit of pain, not much, just a little bit. So I'm gonna let that do better. I just want to come on here and tell y'all I miss y'all. Thank y'all for the prayers, and I'm getting back, to myself slowly but surely. And when I do another video, which I'm gonna try to do 2 or 3 during this whole weekend, and just probably upload them, a day at a time next week. I'm going to tell y'all about the Vanderbilt call I had the week that I had the emergency gallbladder surgery. I have to go through another ultrasound because they found a small cyst on my ovaries. And that's what Vanderbilt told me, when the other hospital / transplant center didn't tell me that, Vanderbilt did. And so we'll talk a little about that on the next video. Until the next time I do a video, thank y'all, for reaching out to me with the messages and texts and calls and stuff. And I appreciate it. I love y'all. And I'm doing good. I'm a soldier. I'm just being wounded right now. So I'm gonna take time and get plenty of rest and get myself better so I can get back in the game of life. So until the next video, we'll talk about that ultrasound, about the cyst, and I'll talk to y'all good people later. Good night.